Can everybody hear me?
Yeah.
Yes.
Okay. Right. My chosen topic to talk about today is effective pain relief with acupuncture. Now, Professor Sun yesterday took us through the etiology of pain, and he emphasized how treating the root cause of pain is so important. And I absolutely 150% concur with that. Okay? Where I'm coming into the picture with my talk is when you've done your diagnosis, you know what's going on with your patient, you know it's wind, cold, damp, you know it's hot condition, you've made your mind up about that. Where I'm coming in is exactly how am I going to treat this pain condition most effectively for my patient, causing the least amount of distress for my patient. Okay? Why do patients visit a doctor? I mean, there was a survey done, published in the Mayo Clinic Proceedings in January 2013. And of the top 10 reasons why people visit their GPs now, their primary care physician, pain is involved in 6 of those conditions. Osteoarthritis, joint disorders, back problems, chronic neurological disorders, high blood pressure, headaches, migraines, diabetes. All of these conditions can involve pain. So that gives us an idea of how, well, people do react to pain. They don't like to be uncomfortable. They might live with something else, but they don't want to live with pain. So generally, certainly I've had a few experiences in my clinic where the phone rings and somebody says, oh, I have a lot of pain, it's my shoulder, it's my ankle, or whatever. And you make the appointment, and they come, and the next thing is the ankle, the sore ankle, is encased in plaster. All right? And when I was taught, initially in my acupuncture, we were taught, local treatment. And I do use local treatment, okay? But there are other ways. Sometimes a person where they're sore is very inflamed, the muscles are in spasm, maybe they actually don't even want to let you touch it, okay? So you have to have an alternative. So you have a choice, local versus distal. And very often, distal can be way more effective than local. So when you're putting together your treatment plan, you're going to consider your channel relationships. Now, the first choice is the same channel. So if I have pain on a particular channel, I can treat the same channel. It doesn't have to be locally, it could be distally, but that is a valid choice. I put a little note here to remind me, because it's actually not something I use very often, but it is a valid choice. So we'll be looking at the different relationships between the channels. Some of the channels to me are like identical twins, and some of them are like brothers and sisters. Maybe some of them are like first cousins, and then some of them don't really talk to each other, same as in every family. In the notes you'll find a channel clock. I don't know if any of you have managed to download it yet, but the channel clock basically follows the flow of qi, and we'll be looking at how to use that to choose treatment channels. Holographic body systems, mirroring and imaging. Body zones, are particular areas of the body better for acute pain, are particular areas better for chronic pain. And then you have point categories. So the first obvious channel relationship is Biao-Li, exterior-interior relationships. Okay, that's what we look at first. And then we have the 6-channel system, same name, so Tai-Yang channels, Tai-Yin channels, Xiao-Yin channels, that kind of thing. And then we have the 6-channel system, different name, okay? So in the Biao-Li system, we're following the flow of qi, the first 2 channels, the lung and the large intestine. So the lung channel will treat pain on the large intestine channel. The large intestine channel will treat pain on the lung channel. Lung 7 is a fantastic point for pain in the area of large intestine 14. Stomach and spleen channel. Stomach channel pain can be treated by the spleen channel. Spleen channel pain can be treated by the stomach channel. Stomach 39, for example, treats lateral costal pain, which is radiating into the abdomen. Stomach 35 is a fantastic point for elbow pain on the large intestine channel. It's also a very good point for pain on the medial aspect of the knee, so pain on the spleen channel in the area of spleen 9. Okay. Heart and small intestine channel. Heart 7, Shen Men, treats sciatica. Sorry, this is the wrong note there. Heart and small intestine channel. Heart 7 will treat pain on the small intestine 10 area, roughly. Small intestine channel will equally treat pain on the heart channel. Small intestine 4 is actually one I use for pain on the inside of the elbow joint on the heart channel. The bladder channel and the kidney channel, again, one will treat the other for pain conditions. Bladder 7 and 8 on the top of the head would be points that I would regularly use for sole pain, which is in the area of kidney 1, kidney 2. Pericardium and Sanjiao. Pericardium 3 will treat pain in the area of Sanjiao 10. The other interesting thing about pericardium and Sanjiao channels is that the pericardium channel will treat pain on Renmai, okay, and the Sanjiao channel will treat pain on Dumai. And if you think about the pericardium channel and how many of those points are indicated for things which happen in the area of Renmai. So you have P6 for nausea, you have P5 will treat menstrual problems, so we already have that connection there, we already have that relationship there. Sanjiao channel is fantastic for central pain on Dumai. The gallbladder and the liver channel, another exterior-interior pair. Gallbladder 40, 41 will treat pain in the area of liver 10, liver 11. All right. So now we're into the 6-channel system. And these are the channels I think of as identical twins. So we start with Tai Yang. So we have the bladder channel and the small intestine channel. And I suppose really it depends on where you come from, but when I learned my initial Chinese medicine training, this 6-channel system wasn't really emphasized to us. We were taught the 12 channels and then the 8 extraordinary vessels, and it's only when I found the 6-channel system that, the relationship and why all these channels work together, exactly why is small intestine 3 so good for headache, occipital headache. Because occipital headache is on the bladder channel and the small intestine channel and the bladder channel are really one channel, okay? And we can say the same for the 2 tie-in channels, the lung and the spleen channels. Spleen 9 is a point which I always use if my patient is complaining of anterior shoulder pain. So in other words, lung channel shoulder pain. Gallbladder and Sanjiao channel, 2 Xiaoyang channels. And again, with this very, very close relationship. Sanjiao 19, for example, treats pain of the lateral costal region. Well, the Sanjiao channel doesn't go near the lateral costal region, but the gallbladder channel does, you know. And when these two channels are like identical twins, then they have a very, very strong effect on each other, okay? When we get into the holographic systems and the mirroring and imaging on the body as well, the eyes are the center of the head. Sanjiao 19 is pretty well level with the eyes. You know, lateral costal is more or less the center of the torso. Okay? And the more of these, as we go through this, the more of these systems you can get to agree with each other. Okay. The more of these systems that we can get to agree with each other, the stronger your treatment effect is going to be. All right? Shaoyin channels, heart and kidney channels. Kidney 10, pain in the area of kidney 10 can be treated by heart 3 and vice versa. Pain on the kidney channel will be treated by the heart channel. Pain on the heart channel will be treated by the kidney channel. The Yang Ming channels, stomach and large intestine, again, will treat each other. When I have patients in the clinic, I get a lot of pain patients, you know, and in pain you get a lot of shoulder injuries, you get a lot of elbow injuries, sporting people, that kind of stuff. I don't treat locally. Large intestine channel problems, I always go to the small intestine channel on the leg. Or sorry, stomach channel on the leg. Jueyin, liver, and pericardium again will treat each other. And as I mentioned already, we have pericardium 4 treating pain of the chest or the lateral costal region. We have pericardium 6, we all know for nausea and vomiting, but also for pain in this area. We have pericardium 5 for treating menstrual problems. Okay? Pericardium channel connects all 3 jiao, and it has a very strong relationship to the liver channel and to the liver organ. And then we have the 6th channel, different names. So Tai-Yang channels will treat Tai-Yin channels, or Tai-Yin channels will treat Tai-Yang channels. So that means the bladder or small intestine channel will treat the lung or spleen channel, or vice versa. Right? But this is a very big topic to try and cover in such a short space of time. But are you starting to see how suddenly treatment choices are starting to open up? The Shaoyang channel will treat the Shaoyin channel, and vice versa. Gallbladder 34 will treat pain in the area of heart 3. Sanjiao 4 will treat pain in the area of kidney 3. And then lastly, before we move on, we have the Yang Ming channels and the Jueyin channels, and again, they will treat each other. Okay? So stomach 36 will treat pain in the area of liver 13, liver 14, liver 10, liver 11. Stomach 41 will treat pain in the area of pericardium 7. Large intestine 4 will treat pain in the area of pericardium 2. And pericardium 7 will treat pain in the area of large intestine 14 and large intestine 15. Right? So really what we've done now is we've looked at a quick overview of the channel relationships, but this is really only the external pathways of the channels. The channel pathways on the surface of the body on which the acupuncture points are located. Sometimes what we're inclined to forget are the internal pathways, and it's very important to know your internal pathways. Because not alone do the internal pathways of the channels link different body organs, they also link different body locations. The liver channel, for example, ascends to do 20, to bike way. The gallbladder channel traverses the cheek. The gallbladder channel on the foot is one that I will use for face conditions, Bell's palsy, stroke conditions, that kind of thing. The lung channel, we all know, an internal branch ascends to the throat. The stomach channel, from stomach 8, travels across just inside the hairline to meet with do 24. So if you think of the stomach channel is so good for relieving frontal headache. Why? Because I mean, the stomach channel begins here. It doesn't travel up here, or does it? Yes, it does. Right? And the pericardium channel, as we said, connects all 3 jiao. Pericardium also connects to the uterus. You've got to remember all these connections. Now we have the channel clock, which starts at the lung, large intestine, stomach, spleen, heart, small intestine, etc., all the way around to the liver channel. Okay? It's not based on time, it's just the channels, it's just the flow of qi. So, I mean, essentially you can start with anywhere, it doesn't really matter. Neighbouring channels on the channel clock will treat each other. So, the lung channel will treat the large intestine channel, and the other neighbour for large intestine channel is the stomach channel. Alright? And if you think of it, lung and large intestine are piao li, large intestine and stomach are yang mei. Okay, so you can start to see these relationships being repeated again. Opposite channels on the channel clock will also treat each other. Okay? So we've taken the example of the large intestine channel. Opposite the large intestine channel on the channel clock is the kidney channel. So the kidney channel is now going to treat pain on the large intestine channel. Then if we look at acupuncture points themselves and categories of acupuncture points, the Neijing, in the Neijing it says that two stream points are indicated for heaviness of the body and pain in the joints. So if somebody has pain in the joints, you should be including a shoe stream point in your presentation. You should also consider using Huijiao points, meeting and intersection points, where two or more channels meet and mingle. Alright? Essentially, one needle, you get two channels, so you get more bang for your buck. Local points, adjacent points, distal points. Do you want to use a chain and lock system on the same channels? Or then we have what can be known as empirical points, points which are particularly good for treating particular conditions. Now, I hate it when somebody says to me, oh, this is an empirical point.
It works, you can come here.
Sorry guys, I just thought it was important to try and keep going because I know time is a consideration for everybody. Okay, I was just saying I hate it when somebody says something is an empirical point. If they tell you it's an empirical point for something, it probably means they don't know why it works. Alright? So, if somebody tells you that such and such a point is an empirical point for something, large intestine 4 for headache or for gynae pain, sit down and figure it out. Okay? They should also sit down and figure it out. The 1D Neijing also says, if the disease is below, select points on the upper. Bai Hui, do 20 is a fantastic point to treat hemorrhoids. Also a fantastic point for heel pain, heel spurs. If the disease is above, select points below. Tai Chong, liver 3, treats vertex headache. But we already know that because we know that an internal branch of liver 3, of the liver channel, travels to the vertex. If the disease is on the left, treat using the right. If the disease is on the right, treat using the left. So now we're into contralateral needling. If the disease is on the back, select points on the front. And vice versa. If the disease is on the front, select points on the back. Ren 3, Zhongji, treats lumbar pain. Baliao, the 8 bone holes, bladder 31 to bladder 34, treat irregular menstruation. Points on the central aspect of the body can be used to treat the extremities. Gallbladder 23 and gallbladder 24 are both indicated for lots of use of the 4 limbs. Points on the extremities can be used to treat the central aspect of the body. And we do this all the time because we use the transport points, the antique points, the Jingwell point, the Yin Spring point, the Shu Stream point, the river points, the sea points. And then we start to think about body zones. Are there particular areas of the body which are better for treating particular types of conditions? Acute conditions versus chronic conditions. Now, for this, I kind of dip into Master Dunn's acupuncture. And in Master Dunn's acupuncture, the fingers, the hands, and the face and the head, so that's zones 1, 2, and 10, are commonly used for treating acute conditions to effect quick symptom management. The thigh and the leg, zone 7 and zone 8, are used to treat more chronic conditions. Now, when you have your patient come into the clinic and they have their sore shoulder or they have their, well, I'll tell you a story of what happened to me about 2 months ago. A motorbike cop pulls up and takes off his helmet and walks in the door, and he says to me, by any chance are you free? He'd had a motorbike accident 9 years earlier, slid, and the sole of his foot took full impact. So basically he made a mess of his ankle joint, and he broke the tibia and the fibia in his thing. And he said to me, I have 20 minutes. He said, I have to be gone, I'm still on duty, I have to be gone in 20 minutes, but my pain level is at 9 out of 10, right? So he's there in all the letters. I got him to take the boots off, all right, so I could see the foot and the ankle, but he didn't have time to get out of all the letters, and I love a challenge. So I said, okay, well, we'll try it. So I started treating his opposite hand. Okay? His pain went from 8 out of 10 to 4 out of 10 inside that 20 minutes. He was out the door in 20 minutes. That pain relief lasted for him. He made an appointment, he came for a regular treatment. Okay? Now, I suppose in a funny way I was breaking the rules because I wasn't treating the root at the time. I was giving him some relief which lasted for a few days, but that wasn't going to last forever. So he knew he had to come back for a fuller treatment, and he did. But it just shows you how effective this method can be. When you needle, that sounds better. Yeah. When you needle away from the site of pain, you then get the patient to mobilize where it's sore. Okay? So with this guy, I was needling his hand, and his pain was between the stomach and gallbladder channel, so I was needling between the large intestine and Sanjiao channel on the arm. How did I find the places to needle? I found them by palpation. Okay? You then get them to mobilize the area that's sore. If you have the right points, the pain literally starts to go melt. It's amazing. I've been called a witch. It happens so fast. The beauty of that method is you get instant feedback. Is the pain starting to recede? Yes. Okay? If it's not receding within 2 minutes, you haven't picked the right treatment points. That's a general rule of thumb. And you can then go on, once you have the pain receding, you then go on and you do your root treatment. Okay? The fact that you have no needles in the sore area also means as well that you can apply some different local treatment. It might be moxibustion, it might be heat lamp, it might be a liniment, it might be a little bit of massage, but it makes the overall treatment more effective. I don't care how my patients get better. All I care is that they do get better. Okay? And I find that the more you can throw at them, the quicker results you get. So we think of a macrocosm, if you like, is any large organized system considered as a whole rather than as separate units. So the entire body is a perfect macrocosm. A microcosm is a small place or a small society that has the same characteristics as something much larger. Okay? So we're familiar with the idea of microcosm and macrocosm already in Chinese medicine. Okay? And we just take that to a new level. Now, most of you will be familiar with aspects of this anyway. We have ear acupuncture, where we can treat the whole body through the ear. We have scalp acupuncture, where we can treat the whole body through the scalp. So this is not a new phenomenon. We have abdominal acupuncture. There's Korean hand acupuncture. These are all using a little part of the body to treat the whole of the body. So what we do then is we take that to a slightly different level. I can treat my left arm by using my right arm. I can treat my shoulder by treating my opposite shoulder. I can treat my elbow by treating my opposite elbow. I can treat my wrist by treating my opposite wrist. My hand by treating the opposite hand. All right? Everybody understand that? Okay. Now you can flip the image. So I can treat my hand by using my shoulder. I can treat my forearm by using my upper arm. I can treat my elbow by using my elbow. The elbow, the midsection still stays the same. Okay? And finally, I can treat my shoulder by using my hand. So we're just flipping the image. So we do the same with the legs. One hip will treat the other hip. One knee will treat the other knee. One foot will treat the other foot. And then we can flip that again. So we can treat the foot with the hip. We can treat the calf with the thigh. The knee stays the same. We can treat the thigh with the calf. And we can treat the hip with the foot. All right. Now, I know this is a lot to take in, especially when we haven't got the diagram. All right. And then we complicate it a little bit more. Because we can use an arm to treat the leg. So the shoulder will treat the hip. The upper arm will treat the thigh. The elbow will treat the knee. The forearm will treat the calf, and the hand will treat the foot. And then we reverse that again. Okay? So we can treat
the hip by treating the hand. Heart 7. I know this is an awful lot to take in, but especially without the diagrams. Heart 7 for sciatica on the gallbladder channel. Alright? In the region of gallbladder 30. We can use the forearm to treat the thigh, the elbow always treats the knee, the upper arm can treat the calf, the shoulder can treat the foot. Start to think about points with funny indications. Start to think about, you know, we can take the arm and we can image it onto the body. So the shoulder will treat the head. So we have large intestine 14, isn't it, is indicated for nasal problems. Now yes, okay, large intestine 14 is on the large intestine channel and the large intestine channel ends here. No big deal about that, okay? You strengthen the image. You think about taking the arm across and the shoulder onto the torso, onto the head, and then we have an overlapping image. We have an overlapping thing which is going to make our treatment stronger. In the area of the elbow, we can treat conditions which happen in the area of the umbilicus. The hand will treat lower jiao problems, lower jiao conditions. I mean, large intestine 4 is the perfect example of that. For gynae pain, promote labour, all right? But we can also then flip that image. So the head is treating the hand. Large intestine 4 is also indicated for headache. It's an awful lot to take in, guys, all right? And I'm not asking any of you to take me at my word. What I would ask you to do is think about it and go home and try it, okay? We'll just run through a quick example. So if I have pain on the gallbladder channel, I've twisted my ankle, and it's sore and it's swollen. What are my treatment choices? I can use the same channel. I can use the gallbladder channel, I can use it locally, I can use it somewhere else. But same channel treatment is, yeah, it's fine. Exterior-interior relationship. So now I can use the liver channel to treat the gallbladder channel. 6th channel, same name, Shaoyang. Now I can use the Sanjiao channel to treat the gallbladder channel. The 6th channel, different name, heart and kidney. Shaoyin will treat Shaoyang. Neighbours on the channel clock. So liver and Sanjiao will treat the gallbladder channel. Okay. Opposites on the clock. The heart channel will treat the gallbladder channel. And then we have the body zones, acute versus chronic. This is an acute problem. The hands or the face or the head are going to be better than the calves or the thighs or maybe the central part of the body. Mirroring and imaging. So we have the hand treating the foot. The foot will also treat the foot. The hip will treat the foot. The shoulder will treat the foot. I mean, you know, essentially any long bone in the body, and a long bone doesn't have to be a bone like your femur. It can be a bone like this, it can be a bone like this. Any long bone in the body can treat. You can make a holographic system, you can do a mirroring and imaging on any bone, any long bone in the body. So you start to see how stuff really kind of starts to open up for you. And with my acute ankle problem, it's a joint, I have pain in the joint, so we're going to want to use a shoestring point. Okay? Now, if we're going to say that I want to use moxibustion, or I want to use the heat lamp, and I want to use a liniment, so we're not going to use local treatment, we're going to use distal treatment. when you look at the little list we've run through, same channel treatment, exterior, interior, 6 channel, same name, 6 channel, different name, clock neighbours, clock opposites. When you look there, you will see that the liver channel has been mentioned twice, the heart channel has been mentioned twice, and the Sanjiao channel has been mentioned twice. Now, channels that pop up like this, twice, 3 times, sometimes 4 times, they're your first choice because they're going to be strongest, because you have methods of selection, if you like, that are overlapping, or you have images that are overlapping, and that is going to give you your strongest treatment, okay? So, liver channel, heart channel, Sanjiao channel. What points are we going to use? We've already said that we'd like to use shoestring points, all right? I always believe that you don't want to be putting too many needles into a patient. So we have the choice of liver 3, heart 7, and Sanjiao 4, and we're only going to use 2 of those. Anybody guess what one we're going to leave out? We're going to leave out liver 3. Why are we going to leave out liver 3? Because it's on the foot, and because this is an acute condition, and the hand treats acute conditions a little bit better. Okay? It's not, liver 3 is not wrong, but it's maybe not just the absolute best one to pick. So, I'm sorry we didn't have slides, because it would have been much easier for you if you had the slides. But at least you can get the slides from the website. My email address is on there, so if anybody has questions, please, you can get in touch with me. And then finally, I would just like to say, always remember your channel qualities. And particularly, I always think very important when you're dealing with pain conditions, and particularly if they're chronic, are the Yang Ming channels. Why? Because Yang Ming is full of qi and blood. Okay? And pain is an obstruction, and you want to move qi and blood. Needle techniques. There's so many of them. Doctors differ and patients die. You do whatever works. Needle retention time. I think this was touched on earlier, that in every day there are 50 cycles of qi, 25 of yang qi during the daytime and 25 of yin qi during the night time. Now, if you want to be calculating about that, you divide that up in minutes. It works out 28 minutes and 44 seconds, something like that. 30 minutes. I'm inclined to leave my needles in for 30 minutes minimum. Okay. So my aim is to try and affect at least 1 full cycle of qi. Then you have, like, needle depth, and you have tissue correspondence. So if you want to treat the skin, you only needle the skin. So in other words, very shallow needling. If you want to treat the spleen, you're needling into a muscle, you're needling into something that has a belly, a good muscle, so like stomach 40, for example, If you want to treat the liver, you're needling close to a tendon, or right up to a tendon, so that the needle is just barely touching it. The same if you want to treat the heart, okay? All these things, the heart is you're needling close to a blood vessel, all right? So all these things come into the mix. If you want to treat the kidneys, you needle so that your needle is just barely touching the bone, all right? And the other thing to think about is palpate your patients. Don't be afraid to palpate your patients. Sometimes I find that students are wary about putting their hands on the patients. Put your hands on your patients, feel the channels, and you will get a lot of information from that. You'll feel whether it's hot, whether it's cold. Is it puffy, spongy, so therefore they're damp? Is it a hot condition? Is it, you know, is it deficient? Is it excess? You'll feel all that from there. And then finally think about your patient profile, because your 50-year-old lady that comes into you with a sore shoulder is going to be different from your 20-year-old male that comes into you with a sore shoulder. So your diagnosis and your pattern differentiation are very important. All right. So finally, I just wanted to say thank you to Professor Shulam and to the organising committee for inviting me here today. And thank you all for listening.
Thank you very much, Kathleen, for your fantastic speech, particularly in this accident. I'm sorry for that. And thank you very much for our colleagues. They are hardworking, like almost there. So now we could have two questions. Any question? Oh yes. Where's the speaker?
Dora, it's fine. Is there any kind of simple route to follow? Because let's say in any inside, outside, upper bodies, lower bodies, the same meridians upper place, lower place. But for example, it's not a really crazy problem. But how are you going to choose it? It's very complicated. But is there kind of...
Well, it actually sounds complicated, but if you actually sit down and just write it out, and if you look at the third or fourth last page on the slides when you manage to download them, it gives you the list there, okay? And you start out by just having a piece of paper, okay, same channel as this. Yali channel, that's what it is. 6th channel, same name, that's what it is. 6th channel, different name, and you actually just write them down. That's how you start, and that's how, because it's a lot to try and think of, okay? So if you have a sore wrist, chances are I'm going to treat your ankle. That's my preference, okay? I could use your opposite wrist, I could use your opposite shoulder, I could use your hip, I could use your knee.
But yeah, that's my question. You know,
Yeah.
you could use all of this, but which one will be the best solution you're going to choose, or the formula?
Okay, if you just start out by doing the very simple, that the shoulder will treat the hip, the upper arm will treat the thigh, the elbow will treat the knee, forearm will treat it. So if you just start out with a very simple mirroring an image in a very simple map, don't worry about flipping it, or don't worry about, and then you look at the channels involved, and then you palpate the patient. But it does take a little bit of getting used to, but the only way to do it is to actually sit down and write it out. You don't have to do it for very long, you know, and you also have the channel clock on the slides. And what I did with my channel clock was I laminated it and I stuck it on the desk, so that I can see that, you know, and you just get used to it, and you get used to thinking about it, you know.
Thank you.
Okay.
Excuse me, when you mentioned about please remember channels quality, and you did like example Yang Ming, can you say a bit more about it?
Okay, well, just Yang Ming is the channel which is full of qi and blood.
Yeah.
If you think about Yang Ming is stomach and large intestine, okay? So the organs, we eat our food, we drink our drinks or whatever, and the body is trying to get the essence of the food distributed as quickly as possible. So that job takes a lot of energy, takes a lot, so there's a lot of qi and a lot of blood for an effective distribution system, basically. And so movement, promote movement, okay? So a Yang Ming point can always be a good one to include in the mix. Basically, that's what I'm saying. Then you're invoking the Yang Ming quality, Yang Ming qi and blood for movement, to promote movement. Because pain is an obstruction and you have to promote movement.
Yeah.
Yeah. Does that explain that?
Yes.
Yeah.
Thank you.
Thank you, Kathleen. Thank you again. Thank you for all your cooperation. Now we are exactly here. Let's welcome our last speaker.
Professor Fu. He is the inventor of